Fellow Ghanaians, good evening. I wish all of you a happy and prosperous new year. We have to be thankful to Almighty God for seeing us through 2020, undoubtedly one of the most eventful years in the history of mankind. I'm sure that many, at the stroke of midnight on 31st December, were happy to see the back of 2020, the global pandemic of COVID-19 being the main reason. Unfortunately, COVID-19 is still with us, and that is why I've come into your homes for the 21st time to provide you with further updates on the decisions taken by government to try and bring our lives safely back to normal and achieve our ultimate goal of zero active cases. Since the announcement on Wednesday, 11th March 2020, of the first set of restrictions to help win the fight against the virus, several others have been imposed by government to this end. Measures, including the temporary partial lockdown of the Greater Accra metropolitan area, Tema, Kaswa, and the Greater Kumasi metropolitan area and contiguous districts, the closure of our schools, the adherence to enhanced hygiene, social distancing, and mask-wearing protocols, the ban on public gatherings, and the closure of our schools and our borders impose considerable difficulties on all of us. A number of these restrictions have since been eased, and others still in force. As of 1st January, the number of active cases in Ghana stands at 879 cases, with 53,005 recoveries, 18 severely ill, but no critical cases. We've conducted 674,812 tests, with 55,220 positive cases detected. There have sadly been 336 deaths. This is a relatively welcome picture when regard is paid to the data from other countries, especially also at a time when many parts of the world are having to grapple with the second wave of infections and the new variant of the virus, which is said to be more transmissible than the original version. Thus far, we in Ghana have not detected any case of this new variant. Our scientists tell us that the genetic makeup of the virus in the country has still not changed. The Ghana Health Service, with the support of relevant institutions, continues to monitor events closely and will advise government on the way forward. Accordingly, the adherence to the enhanced hygiene, social distancing, and mask-wearing protocols continue to be the tools of our warfare, even when the vaccines arrive in Ghana. By observing these protocols strictly, we're also making sure that the imposition of crippling restrictions and lockdowns do not become options for government. Until then, government, in consultation with the appropriate stakeholders, will continue to pursue a strategic, controlled, progressive, safe easing of restrictions, this time in all public and private basic schools, junior high, senior high, and tertiary institutions across the country, beginning this month of January. The lessons drawn from the reopening of some sections of our educational institutions in the course of last year have put us in a much better position to oversee successfully the full reopening of our schools. Our children must go to school, albeit safely. We are satisfied that in the current circumstances, the reopening of our schools is safe. So from 15th January, our children in kindergarten, primary, and junior high, in both private and public schools, will be back in school. All SHS1 students will start classes from 10th March, with all his students embarking on a single-track academic calendar. Their seniors in SHS2 and SHS3 will, however, return to school from 18th January. I must stress that SHS3 students in all schools, like SHS1 students, will no longer run the double-track system. The expansion of infrastructure at the various senior high schools over the last 3 years has brought us to this favorable situation. However, the double-track system will still be applicable to SHS2 students in schools that are employing it. Students in universities and other tertiary institutions are to be in school from Saturday, 9th of January. Prior to their return to school, government through the Ministry of Education and the Ghana Education Service will ensure that all institutions, public and private, are fumigated and disinfected. Schools and institutions with their own hospitals and clinics will be equipped with the necessary personal protective equipment and have isolation centers to deal with any positive cases. All other schools and institutions without their own clinics and hospitals have been mapped to health facilities.